Testing. Hi there, guys. My name is Rohan, and today we are going to be talking about heart attacks. Today we're going to be talking about what they are, how they happen, how can they be prevented, and what is the treatment for them. Okay, so around 7 million people die a year due to cardiovascular diseases. One of the most common of these diseases are heart attacks. But how? Like, what are they? So one thing we have to know about our heart is that it needs oxygen. Okay? And during a heart attack, your heart can't get enough oxygen. You see, our heart, outside of it, right, there are a bunch of arteries supplying blood, oxygenated blood to the heart. But sometimes, okay, these plaques, okay, a bunch of fat form up, creating these plaques in the arteries themselves. And as we age, these plaques grow, okay, they slowly grow up. Sometimes they can be chunky, lumpy, hardened, or even inflamed. But in any case, they will eventually become blockages, right? And oxygen supply will be start to get a bit slow. But the worst part happens is when it breaks. Just some of it falls away or even cracks, right? The body thinks like, oh no, that's a part of our body. We have to fix that, right? So a blood clot will form, but this blood clot will just end up creating a blood wall, okay, which basically prevents the oxygenated blood to go to that area of the heart, which basically that means the heart cells start to die, which means that shows how the heart can't get enough oxygen. And the thing is, after this happens, the heart can't pump blood properly, okay? Its rhythm can be off, or in some cases, it can just be sudden death with a snap of a finger, boom, sent to the afterlife, okay? Now, some symptoms of heart attacks can include chest pain, which can go to the arm, jaw, back, or abdomen. Some people also get, but it's not like that all in movies. Sometimes some people get nausea or even weakness, okay? And it's less prominent in old people and women, okay? Which have different symptoms for them. And for some people, for example, who have diabetes, for some people, heart attacks can be silent, painless. They just, bam, happen without you even knowing. So if you see someone who is having any of these symptoms, call for help immediately. Get emergency services and contact emergency services to get them to a hospital immediately. Some drugs, okay, like nitroglycerin, okay, and aspirin can thin the blood cells to get through it or expand them, the artery, to blood to prevent the heart attack. Not prevent, but slow it down. Okay, once you eventually get to the hospital, they'll do some tests on you. For example, checking see how off your heart rate is proper, and if during a heart attack it's irregular, stuff like that. Do a blood test, and eventually they will find and locate the blockages in some other tests. Once they find and locate these, they will eventually do some surgery on you, mostly take a balloon and inflate the blockage, break it and inflate it, squishing it down, right? So the blood flow can go. And they'll sometimes, most of the time actually, they'll put like this metal chain over here or something that will basically keep that artery open. Okay? That's what they would mostly do. But the best way to stop a heart attack is to prevent it from even happening in the first place. So, how do we prevent heart attacks to come? Well, just have a good and healthy lifestyle. Since heart attacks can occur due to two things: genetics, which we don't have control over, and our lifestyle, which we do have control over. Exercise more often, eat a healthy diet, and get weight loss so that way no fat can clump up, okay? And if the doctor prescribes it, eat some medicine and some drugs that can help, okay? That's basically what a heart attack is in a nutshell. That's basically it. Thank you for watching this video, and hope to see you next time. Bye bye.